Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everybody. Welcome back to the Medical Collective, another group podcast episode. I'm so excited. And we're continuing the series on what patients may be missing right now. We talked about supplements. Now we're going to talk about natural medicine and also what preventable illnesses have come back. I'm saying would have come back to haunt us, to be honest, because vaccines, vitaminK, measles, all of these things are preventable, but yet, however, we have come to a point where they have resurged. So let's talk about all of those things today. And honestly, it's about trust and confidence. I think it's starting to erode in our society in the United States of America and beyond. Questions about scientific advancements, questions about how physicians are practicing, all of those things we're going to talk about today. And I think all of us would agree that prevention only works when we have a society that's able to work and believe in it, right? We can say all the time that we need this medicine, we need people to take this vaccine, and if they don't uptake it, if they don't trust in science, then we can't do prevention well. Once a child develops measles, for instance, how many of us, and Dr. Atoosa, we talked about this on an episode, how many children have we seen with measles, and it's only because the parents didn't get the child immunized, or they die 10 years later from the sequela, like subacute sclerosing panencephalitis, about treatment and not taking treatment. So Dr. Atoosa, we've done the vaccine episode before, but these conversations feel different. It kind of feels repetitive, but now I feel like we're on a different path. We're 10, 15, 20 years into things that should have been prevented. We've got 2,000 cases of measles, y'all. 2,000 cases of measles. So what are your thoughts? Dr. Atoosa, how have these conversations changed during the years? Since the last time we even had the episode about vaccine preventable illnesses.
It's true. It feels like things have become more dire. We have more viral outbreaks. The measles epidemic has only escalated in the past year and a half. And now vaccines are being taken off the table, and there's going to be difficulty accessing certain vaccines. And I feel like I was prophetic in our last episode because I said, if the government changes its stance on vaccines, soon they won't be available. So if you want to get vaccines, get them quickly before they're gone. And now they're starting to restrict access to COVID vaccine. And they're also taking away some of the recommended vaccines on the pediatric vaccine schedule, which means soon those will be more difficult to access, especially with underserved populations that rely on government programs to get vaccination. So it definitely feels tougher and more dire than before. So yes, we have the resurgence of measles, which we hadn't seen this kind of outbreak in 30 years. And even the last time there was an outbreak in the early 90s, it wasn't this bad. So this is the worst outbreak we've had literally since vaccination was implemented. And then we had almost eradicated polio, like there hadn't been a case of polio in the US in decades. And now we're seeing cases pop up. So polio is no longer eradicated. We lost our polio eradication status, which we had been granted by the World Health Organization. So yeah, it feels like the old times and a little like the end times. It's like, the terrible diseases are coming, and if you're not vaccinated, they could get you. So I don't want to be a scaremonger, but that's the reality.
And something else that has become very popular is not just Google, but AI. Yeah. And parents are using influencers, podcasts, ChatGPT. I use it. And sometimes just because they have simple questions, but How do you distinguish curiosity from distrust from your parents? And you too, Dr. Sharon, from your pregnant persons?
I think it's the way the questions are phrased, or there are people who are saying, I don't even want to have the vaccine discussion with you. Like when I find out that their child is not vaccinated for measles and I express concern that they are at risk for contracting and dying of measles, they say they don't even want to have the discussion with me. But other parents are like, I'm scared because, and they express their fear, and or we're not vaccinating at all. They say that, and I say, may I ask why? And then they tell me some horror story of something that happened to their aunt, like 17 years before. And it has nothing whatsoever to do with their child or any kind of vaccine reaction their child might have had. They didn't, but it's something that they extrapolated all mistrust of all vaccines because there was one supposed vaccine reaction, which it hasn't even really been proven that's what it was. But even if it was, so I think that's the kind of thing I see is there is hesitancy and there's outright anti-vaccination status. And those are two very different things. And with hesitancy, curiosity, even fear, there's room for discussion. Because even if you have fear of something, you should be able to talk about it. I'm literally not running at your child with a jab in my hand. I'm literally having just a conversation with you. And so that's the way I distinguish it. And whether someone is open to the conversation is important. And as closed as they may seem, I still try. I still say, hey, I'd love to have a conversation with you, and, respectful, with curiosity, with discussing your views and why you came to believe this way, and showing you what I've seen as an immunologist.
And even during the beginning of the pandemic, when we were on the social audio app Clubhouse, we noticed there was a lot of distrust, right? But we realized you don't win arguments, right, by throwing data and facts at them and statistics. Trust isn't built by winning an argument or by showing data. It's built through relationships. And that's even having conversations, right, about your general health, working out. We show the other side of us, breathing brunch. All those conversations help. And I remember you, Dr. Sharon, even saying in some situations, you love the questions. Bring on the questions. You got the notepad, you got the chalkboard. Let's have the questions. But it has to come from a sense of being genuine, right, and really curiosity. And how do you do the establishing that conversation, Dr. Sharon?
So for me, I invite questions, and I always tell my patients, I'm like, you can ask me as many questions as you want to, as many times as you want to. That will help you understand, what we're doing and why we're doing this. And I usually further mention, I have no, besides a public health aspect, right? Because I'm vaccinated because I care about the next person. I'm vaccinated because I take care of pregnant women. They're immunocompromised. So I don't want to be the carrier of anything to any pregnant woman. So I'm vaccinated for you, not only for myself, for you. Right. So at times I'll explain it that way. And I think that helps in the hesitancy. And then, because then I'm and a lot of times also this may be with a patient in labor who's just about to have a baby, who came in with an extensive birth plan and is refusing all vaccines, vitaminK, refusing everything. So then I'll start the conversation there, and then the pediatrician will come in and further enforce what I say and give their perspective on, vaccination and the whole reason why we vaccinate. Right. So that helps. But I usually approach it from a place of information. Because sometimes I meet some parents who are outright belligerent about, about vaccines. So, it's usually try to do it gently. I really have your best interests at heart. And sometimes you reach some patients and sometimes you don't.
That is the part. And we realize that even with conversations, you cannot reach everyone. You just can't, but you can try. We talk about vaccines and we have the episodes on preventable illnesses that vaccines have really helped. But something now I'm seeing that is perplexing me, and you touched on it, Dr. Sharon, is that now there's skepticism towards almost every treatment that is helping. For instance, the vitamin K. The vitamin K, the RSV prevention, eye prophylaxis. Vitamin K, to me, I don't think many patients even parents thought about, saying no to. Vitamin K deficiency bleeding literally occurs in about 1.7% of newborns who do not receive this prophylaxis. And that's what it is. Prophylaxis is preventative. Late vitamin K deficiency bleeding occurs in some primarily breastfed infants who do not receive it. Approximately 30 to 60% of late bleeding from this can cause intracranial hemorrhage, which is bleeding in the brain. Mortality rates, if you have that, is up to 20%, 14 to 20%. And many that survive it have permanent neurological injury. So let's talk about vitamin K. Let's talk about one of them, because I think explaining and talking about it will help those who are listening maybe share and think next time when they have a baby that they get it.
Yeah, I think this is such an important topic. I think it's been lumped in with neonatal vaccines, and part of that, the vaccine hesitancy has just bled over. Pardon that. I didn't mean to pun that. No pun intended. It's bled over into the vitamin K hesitancy issue. And parents are like, well, why don't you just give them an oral form of vitamin K if they really need it? Or why don't you test their vitamin K level? And frankly, there is no functional way, clinical way to test whether a child has a significant vitamin K deficiency. It's at the cellular level. And so we can't just check a blood level of vitamin K and decide which newborn needs vitamin K. And we know 2 out of 100 will need it. And so that's why we give vitamin K, because to prevent those bleeding deaths and brain damage that can happen with those bleeds. And people say, okay, well, why don't you give them an oral form? And there is no oral bioavailable form of that vitamin K. There is oral vitamin K2, but that is a different vitamin. It is an entirely different vitamin. That's like saying, well, why don't you give them an oral form of vitamin B6 when what you were deficient in was vitamin B3. So it's just, yeah, that's it. So there's 2 different vitamin Ks. There's a vitamin K1 and a vitamin K2, and that's what people don't realize. So literally this dad said to me, well, I take vitamin K2 with my vitamin D, and can't we just give her vitamin K2? And I'm like, no, it's a different vitamin K, and it's not going to prevent that kind of bleeding. And so I think it's a lot of miseducation, and also a tiny bit of information, like a little bit of knowledge is a dangerous thing, is that expression. A little bit of knowledge about like the cofactor for vitamin D absorption, which is vitamin K2, makes them believe that they know something about vitamin K1, which they do not. And so that is the kind of conversation I have. And I really tell the story. We talked about how storytelling is more powerful than data. So I tell the story of volunteering as a young doctor in China at a rural hospital where they did not have vitamin K injections available, and watching babies literally bleed into their lungs and die, watching babies bleed into their brains and die. And I tell those stories, and I'm like, if that starts happening, there's literally nothing we can do at that point. Giving them vitamin K at that moment will do nothing at all. So it will not save a baby once the bleeding begins. And the only way is to prevent. So those are the conversations I have with parents. And for the most part, they work. And then also having alignment of multiple health practitioners on the same messaging helps. So for one family, I said, hey, why don't you talk to your midwife? Because I think she will also have a similar stance. And the midwife said, yeah, even if you don't want to give the hepatitis B vaccine or whatever, I would give the vitamin K, because she'd also seen bleeding complications. So she could speak to it from her own experience of home
But she
birth.
hasn't seen liver cirrhosis from hepatitis B.
I guess not. That's not in her wheelhouse, right? But you've seen that, and maybe we've seen it, but she hasn't seen that. But she had been to enough home births to see neonatal bleeding, so she knew that was a big risk. And midwives, especially who've been midwives for 30 plus years, like before we had the injection, will tell you that they've attended home births where terrible bleeding complications happened, because bleeding is a higher risk if there's been pressure on the newborn skull, or some other or forceps delivery or a difficult delivery. It's even higher risk, as Dr. Sharon can speak to.
And I want to quote real quick. It's a quote from somebody, that vaccines are a victim of their own success. I think that was Dr. Atoosa that said that on episode. Right. And it's because the brain bleed that never happened from vitamin K, the ICU admission, the emergency surgery that never happened.
Yeah.
That's why vaccines are a victim of their own success. And why do you think that the skepticism has expanded beyond vaccines, Dr. Sharon? Because Dr. Sharon, already in the middle of an emergent procedure, is getting questioned about every single thing that she's giving a patient.
Mm-hmm. So I think the hesitancy comes from a lot of different areas. But, what I would explain, I've explained to them that vitamin K is a fat-soluble ingredient that's needed to help your liver make those clotting factors that are necessary for clotting. Hence, if you don't have those clotting factors, you can have a brain bleed, or you have a baby boy, you want the baby boy circumcised. Well, that's not going to happen, because we depend on those clotting factors to help. And then, yes, they will ask about oral administration of vitamin K, just like Dr. Atoosa just explained. But once I explain that, some may waver, some may think about it, some will still flat right say no. I'm not giving vitamin K, and it becomes challenging. And some of the concern is that some parents just don't understand why we give it. Right. So once I explain why we give it, or when I refuse to do a circumcision because your baby doesn't have vitamin K, all of a sudden, no, vitamin K is okay. Right. No, I've had that. Right. And I did not have this type of hesitancy and resistance to vaccine at the beginning of my practice. This is something that has evolved over time and has just gotten worse, and just worse with our current climate and people who are making decisions, or healthcare decisions, for people who shouldn't be making healthcare decisions for us at any right. So that is my concern. And I'm worried when a patient decline it for their baby, that they don't really understand. So we hopefully drive home the message, and hopefully I have a couple of days in between me and the pediatrician. We can answer all the questions that they have, and at least help them make a better decision for their newborn. And that's kind of where I stand on that.
I think it's important. I like also that it requires maybe different doctors saying the same thing. It's kind of like I can say something to my daughter, and my husband can say it, but by the third person, maybe Granny says it, then it kicks in. If that's what it requires, if it requires 3 people saying the same thing, then so be it. That's what's going to happen, as long as we get a response. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Okay, so this measles thing, many people may think it's something in the history books, but now we're like living it in real time. And we have a huge FIFA coming, the World Cup coming, and people coming in and people talking about Ebola and hantavirus, but not measles. And I always show the picture of how infectious measles can be, because it really needs to be a conversation at the dinner table. Measles has a very high R0, meaning how many people can be infected with one person with measles, up to 12 to 18 people. Even COVID, that we remember the original COVID, it was approximately 2 to 3 people. And seasonal flu, 1 to 2 people. So measles is very contagious, y'all. We can't forget the rash and the fever, but the fact that it can affect so many other organs. 1 in 5 unvaccinated people with measles end up hospitalized. 1 in 20 people develop pneumonia. And do not forget the thousands of dollars per measles case and the millions of dollars for an outbreak that it costs the economy to deal with this, to do with the contact tracing, all of that. And approximately 1 to 3 people per 1,000 die despite modern medical care. So I don't think people realize how important it is to take advantage of the preventative treatment that is a measles vaccine. Dr. Atoosa, I know we had a conversation on this before, but can you explain why infants are so vulnerable during these measles outbreaks that we have now? And we're up to almost 2,000 cases as we speak in the United States of America.
Yeah. So we know that to make adequate immune response to the measles vaccine, you kind of need to be a little bit older. Like over the age of 1 is when the live virus vaccines work best. And we know that if we can vaccinate a 9-month-old for measles. And sometimes during epidemics, we do that. And you can opt in and get a vaccine before the age of 1. But that doesn't really count towards your vaccination numbers, because a large percentage of the babies who get measles vaccine before the age of 1 don't build long-lasting immunity. So they really need it at 1 or older to get the long-lasting immunity of the measles vaccine. So because of the way the immune system evolves, that's just how it works. And therefore, we want everyone vaccinated to protect these youngest infants from getting exposed, because if you're vaccinated, your chances of getting measles is, if you've gotten 2 doses, is very, very low, like almost down to below 2%. And your chance of getting measles, if you've even had 1 dose, your chance of getting measles is way decreased. And if you get it, you'll probably get a very mild case, and you'll probably not get the other complications like the lung, the brain, and the deadly complications of measles. So I think that is why we are hoping that those who are eligible will get vaccinated or will vaccinate their children who are over the age of 1, because what they do then is protect the younger children who are not yet eligible for vaccination or for whom vaccination would be ineffective. And that's what herd immunity is. That's what community immunity is. Like what Dr. Sharon said, vaccinate to protect others, not just yourself, But even if you're not of that mind, and not only did you say, Dr. Keisha, how much more infective measles is, but I think people don't realize over what range it's infective. Like with COVID, you need to get within a few feet of people, like 12 feet is where it was, right? Between 12 and 20 feet. If someone was actively coughing, they could infect people 12 or 20 feet away. They did these bus studies when in early COVID of people on a bus and how far away were they on a bus, how many seats. And with measles, it's like double that. So literally you could be walking through a crowded shopping center. Someone who didn't even look that sick, maybe just had a little bit of red eyes, had the early stages of measles with watery red eyes. They could be expelling droplets full of measles without even coughing yet. They could be expelling droplets full of measles and infect someone 30 feet away. So I think people don't realize not only how contagious it is, but over what distance, and how unless you're
Long.
like shut in the house. Yeah. Unless you're shut in the house
Airplanes.
anywhere. Yeah. Airplanes is the worst case scenario, right? It's like distributing the droplets all over the place with the ventilation system. So, and contrary to popular belief, even our modern ventilation systems don't get out all viruses. So that's the issue. Even if you have really good ventilation, you can still get measles in walking through an airport, walking through a mall, walking through Walmart or Target, you can get measles. So I think that is where the scary part comes in. And, those who want their children protected, but their children aren't even 1 year old yet, what do we do? So that is the issue. At least up until 6 months of age, there's hopefully, if the mother was vaccinated, some protection from mother's immunoglobulins that have transported through the placenta. However, measles immunity isn't just about immunoglobulin. It's about the training of the T cells, the cells of the immune system, in order to recognize and kill virus. Because there are killer T cells in the immune system that recognize and kill virus, and the vaccine trains those too. It doesn't just train the cells that make immunoglobulin or antibody.
Well said. And if you guys want to know more about measles, we did a vaccine preventable illnesses. Vaccines are a victim of their own success, or every child deserves access to vaccines. And then I also did an episode talking about what measles does to the body from a pathology standpoint. So listen to those episodes for more on that. But remember, you all, when you're talking about herd immunity, don't forget the cancer patients receiving chemo, your loved ones. Don't forget the transplant recipients. Don't forget those that have primary immune deficiencies you don't even know have them, or those that are on immunosuppressive medication. So we need to do this for all of them. And this brings me to the last but most important part of this conversation about this trust is the harm already done. Underneath every conversation we've had today about vaccines, vitaminK, measles, is a question that, can trust be rebuilt? Have we literally damaged the trust? Kind of like a relationship where, once the trust is gone, it's over with. Communication isn't perfect. We can agree with that. Institutions aren't perfect, but what does rebuilding the trust look like? Dr. Sharon.
So I think it's going to take time. I think it's going to take change in the leadership at the top, because for me, the leadership sets the tone.
Yeah.
Right. And it's going to take rebuilding our FDA and CDC. Right. So, because once you tear apart those institutions that I look to for guidance, then we've torn down the structure. We're those people now. We're our experts, right? So it's gonna begin with rebuilding from the top down. And I know people try to build from the bottom up, but I think this is gonna come from changing leadership from top down. And then we can regain some trust. And then for me, as doing my part as a healthcare professional, is to, speak about vaccines, speak about the prevention of vaccine. And I will absolutely use Dr. Atoosa's saying, vaccines are the victims of their own success, because we don't see the ravishing of the vaccine preventable illnesses. So we think that, okay, right? We just don't know. We don't know what the other side looks like. So we just think we live in this hunky-dory land without even knowing what can happen. I do and exactly. I know when
mess around and find out.
Mess. Right. But I absolutely remember when I was growing up in Antigua, one little boy in our community had contracted measles, and he passed away. So, I didn't know what that didn't mean anything to me at that time. I didn't understand that until I'm on this side of healthcare, when I'm providing healthcare for individuals, and I understand what a vaccine preventable illness do to a society, and why are we having so many deaths from a vaccine preventable illness? We're reverting backwards. So hopefully the tide will change soon, I hope. And this is going to be a top-down change. That's how it's going to have to be. This is not going to be a bottom-up change. It's going to be top-down.
I agree with that, but we have to do what we can in our sphere of influence. Mm-hmm. And mm-hmm. I think the more conversations we have with patients, the more likely we are to touch hearts. And the more we establish that relationship and a patient sees that we're just trying to save their lives and make their quality of life better, that's the thing that gives me hope, is that even during the worst of the mistrust, I've been able to reach some people. And even if it's 1 or 2 patients a year that change their minds and get that vaccine, it's enough to give me some hope that people can be reached, and not everyone is anti-science. And some people are just confused by the top-down issues that we're having, right? The leadership that has gotten so astray at the very top of our public health hierarchy, and the people that shouldn't be in charge being in charge. So I think that long-term, as we make those changes at the top, hopefully through our community power and our political power and our votes, as we make those changes, then I think eventually we will be able to rebuild trust in science. But there's no denying how much damage has been done to the cause of science over the past couple of years. Yeah.
And we also have to remember there's trusting science, which some people don't understand, and then there's trusting human beings. And Dr. Atoosa shared on one of the episodes where over and over again, she kept taking care of the patients, and the mother finally said, I'll get the vaccine now because I trust you. Not because I trust that, but I trust you. So it takes time. Again, why we tell you guys, keep going to the doctor, keep bothering Dr. Sharon, keep bothering Dr. Atoosa. And I can tell y'all because I'm behind the scenes. Keep going to see them, keep calling them. It really, sometimes it takes multiple times. I see that even as a parent. It takes time. Nothing happens overnight. So I think that gives me hope. I don't know what gives you all hope in this situation.
Oh, I love that. You're saying that your colleagues working so hard gives you hope. Yeah, I love that. I think there's so many people working hard in basic public health. Like there's people, unsung heroes behind the scenes of public health infrastructure, struggling. Those who have been able to keep their jobs are struggling to keep the public health infrastructure afloat, and they give me hope. And also, I think this is a cautionary tale. We're living a cautionary tale. And there are people in other parts of the world sort of holding the line, looking at the US and saying things could, that could be us if we don't bolster public health. So I think that is part of it, is that there's a missing link of the US not participating in global public health, but that eventually we'll be able to rejoin the rest of the world in their public health endeavors.
Yeah, I agree. Well said.
Absolutely.
What about you, Dr. Sharon? Like, what do you see as like the light or the rainbow after the storm?
The fact that the majority of healthcare professionals out there are on the front lines here doing the hard work, here ready to lock arms to educate the public. And I do see quite a few physicians from different aspects of medicine, different areas of medicine, educating or trying to educate the masses about the benefits of vaccine. So I think once we lock arm and we continue to do the work, because even though the change need to come from the top down, we here are going to have to do the groundwork to get that, to implement that actually.
Well said, well said. One thing that I worry about is when prevention fails, the consequences rarely affect one person. So time is of the essence, everyone. It truly is. We've got to think about our neighbors, I think we need to revisit empathy. We need to realize that trust is listening, transparency, which is why, listen, in pathology, we are transparent, which is why we always say clinical correlation or give you a range or a percentage. It's very important. Nothing truly is black or white. So even when we say vaccines help, we will say there is a small percentage that something could go awry. There is that. We have to reiterate that transparency and the relationships and the respecting each other. We're not seeing a lot of that from leadership. And so if you don't even respect the doctors underneath you and things, how are they going to respect them? They're not seeing that. So I understand, y'all, trust is earned. Trust me, I understand that. But prevention only works if people trust it, use it, and of course, continue to actively participate in the process. Conversations, asking questions, but also understanding you may not understand everything. We may not, but you have to trust the experts sometimes. And I know that's hard, especially now when we have everything in our fingertips. Yeah. So really today, I think that the conversation wasn't about measles or vitaminK or vaccines, and all of those things are so important. But really the question is, I really think the question is what's happening, is it a temporary setback or is it a generational shift in how people are thinking about prevention? Are they now like, we don't need this, this is how we're going to prevent things? And I worry about if this is a shift, a generational shift. And even if it is, we can shift and add to it, right? Take some of the things our grandparents used. That's always important, and reinvent it. That's probably what is happening. But I'd love to know y'all's thoughts by responding in the comments and sharing the podcast. Any final words from you all? Yeah, right.
I think
the generational shift. I'm like, oh.
I hope it's not a generational shift against science. Like, I think what my recommendation is, stay curious and don't feel like if you've made up your mind and you are not open to new data and new evidence and new viewpoints, then that's actually really scary. And it changes the course of your life. It closes down the course of your life. So in general, one of my mottos in life is stay curious. I'm even open to evidence changing how I've practiced, because that's how we're supposed to be as doctors, right? We have changed our practice styles radically from generation to generation in medicine. And I think that's my general advice to everyone, not just to physicians, not just to healthcare professionals, but to people out there who are looking to protect their health. Stay curious, be open, and be open to conversations. Because if your viewpoint is that you won't even have a conversation, then you must be scared that someone's going to change your mind, right? So if your viewpoint cannot hold up to new information or the scrutiny of a conversation, then you got to ask yourself, am I hanging on to a belief system that may be false out of a sense of fear, rather than giving the curiosity and the ability to explore the chance to bring more knowledge and more information and more health into my life?
Well said, Dr. Atoosa.
Yes.
Dr. Sharon?
I think we have to remain optimistic, right? Because we definitely can have a defeatist attitude. We have the data. The data is there, right? Vaccines have worked all my life, right? My grandparents and great-grandparents didn't benefit from vaccines. A lot of them succumbed to vaccine preventable illness. So definitely with a change in administration, with us as physicians keeping the foot to the fire and educating individuals or patients one at a time, right? One person at a time. And in different aspects, at the bedside, in the office, social media, because there's a lot of this misinformation that's on social media. This avenues, such as this podcast, will help bridge that gap. But one thing we cannot do, giving up is like throwing away science.
Mm-hmm.
Giving up will be like really throwing away science.
Mm-hmm.
And I just don't see me doing that.
I agree. And it's the reason why we continue to do this, right? All the bloopers, all of the setbacks, we continue to have these conversations over here because we know you're listening and we know that you care and you do believe in science. So thank you all for listening in again about prevention, and we can get back to prevention and we can rethink it, reinvent it, add AI. I'm all cool with that. But at the end of the day, we still have to do everything based on data and facts and science. So thank you all for joining. This is the Medical Collective, Diverse Doctors, One Mission. Until next time. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.